Hello everyone, my name is Anisha. Today I will be updating you about the implementation of the Matron's Handbook. And this handbook was developed as part of my fellowship at NHS Improvement, and therefore it would be really good to tell you about the progress with the implementation. So Ruth May, the CNO for England, is the sponsor for this handbook, and she has launched it on the 4th of February this year. And after that, the NHS EI team and myself have been doing the national implementation. So that's me there when I was allocated the project, as well as I had quite a lot of ideas to put in prior to starting at NHS Improvement. So there was lots of different engagement and support in developing the Matron's Handbook. You can see Ruth May on her team there. You can also see that there are lots of different trusts and specialists and senior staff who contributed to that. And we have had various trusts that attended to work with on a one-to-one basis to comment on, gain their thoughts and ideas, what they want as matrons to include in the handbook. You can see West Hart Hospital there. That was my host trust at the time. Currently, I'm director of IPC at another trust, Dartford and Gravesham Hospital. We have a matrons network, so make sure you join the network at hashtag Matron Network, and also my hashtag is there as well. This network really helped with launching the handbook and really getting the message across the country and also internationally as well. So the key topics then, as part of the engagement that we had the Ruth May's priorities. We also had the future nurse from the NMC workforce, image of nursing, leadership, CQC well-led, quality improvement were key topics that we looked at as part of the development. So the background to the handbook then is that we hadn't had any recent publication regarding the matron's role. The key roles at the time and the matron's charter was over 20 years old, and therefore we all think that it was a great idea to have the matron's handbook along with its competencies. We also have the ward leaders handbook and the exec nurse handbook, which has been developed by other fellows. So let's talk a little bit more about the purpose of the handbook. In order to get the best from the handbook, make sure you read it, refer to the different sections of it. You can also, if you're looking at the coming into the matron's role, you can use the matron's handbook to get yourself prepared. Also, if you're band 7, you want to use it to look at what your matrons expect of you, use the handbook, as well as if you are a matron and you want to look what you need for your band 7, use that handbook as well. So have a look at the new roles within the matron's handbook. There are lots of different details, links under each section. As you can see, that's more comprehensive in terms of inclusive leadership, governance, digital workforce, education, research, QI. And for the other slides, I will go through some pointers around each of them. So if you look at inclusive leadership, this is really topical at the moment, really important for what we're doing as a nation and even internationally at the moment. We have seen where we've got a higher proportion of staff, for example, from a BME background, has been affected by the pandemic. So that's where we just use all of our skills and knowledge around making sure that leadership is inclusive. And it's all the protected characteristics that we should consider as well. There are nine of them. Make sure that the matron handbook brings you back to a clinical engagement, being visible on your wards and areas, and supporting your staff there. So quality governance, again, is really important to provide assurance to our stakeholders that actually we are doing the best we can for our patients and have it documented, because I know all of us is working so hard. Often we haven't got time to put this great work down on paper, but when it comes to assurance and inspection, it needs to be on paper. So please have a look at the assurance processes. And then you have the CQC framework, which you should link that against. So very topical again, infection prevention and control, which is my current speciality, my day job. So making sure as matrons, you're really leading on IPC in your areas, making sure everyone is doing what they need to do, from audits, other compliance checks, and monitoring, just to get the best out of the day for everyone. So you would have seen various tools for the matron role. We've got the IPS audit tool. If you have a look on within your trust and lies with the infection control team, then again you will find that you have various tools internally. So workforce, this is one of Rusme, our Chief Nursing Officer's key priorities alongside managing COVID and infection control, because at the end of the day, in order to deliver good IPC and other services, we need the workforce to deliver that. So that was a key part of the handbook, which you can find detailed in one of the sections. Patient experience, really important, especially now with things like limited visiting. Even before COVID, patients wanted the best experience from the care. They wanted to see services are joined up, and therefore that making sure that all elements is looked at for patient experience. Performance, this is linked again with the governance element. Around the operational framework and the CQC close, the pathway of care and having the finances to deliver that, making sure that you're really looking at the red and ambers and having processes in place for those. Digital, I know we may think this is a luxury item, but actually to deliver consistent and real-time care, digital technology is really good or important, in other words. So we've got lots of different organizations supporting this, NHSEI, NHS Digital, Department of Health, and a lot of other bodies. Education and training, even though we are currently under high pressure, we do really need to do lots of training, particularly now as we speak, making sure staff are inducted into the organization properly, trained against all the new guidance that are out there, trained on infection control, COVID management, and really supporting staff with those areas. So in order to improve COVID management, you have various different resources. So from the King's Fund, the RCN, NHSEI, and other colleges. Research, again, lots of opportunities currently to do research. So make sure you use that opportunity and write that up as well to share the good work you're doing within your organizations. And collaborative working, sharing that knowledge again, but making sure you use various monitoring tools and you can measure the outcomes. And this will link nicely with quality improvement, where we have different methods of improvement, whether it's the PDSA, CRSA, or the IHI model. But again, there are various examples of QI that you can work with. The matrons framework is really important because that helps to map the things that you're currently doing against what you need. We have got available completed mapping tool if anyone would like. You'll see my contact details in the slide to help you with your mapping and other education related elements. So it comes to the end of the presentation, just a really short summary of the work around the handbook. you'll see that there, if you check the NHS, the Matrons Network, you'll see that there's lots of ongoing event. The next one will be hosted by the East of England, 1st of December, and the next one by NHSEI on the 7th of December. So thank you for listening, and really look forward to your engagement around the Matron's Handbook, supporting the matron's role, and really promoting the role across the country. Thank you.
There we go. Great. Hi, Anisha. How are you doing?
Hello, Steve. I'm doing very well. Lovely to join you today.
Excellent. Sorry about the a few technical wiring up difficulties there, but yeah, no, great to have you with us, and very interesting talk. So we've got about 10 minutes for some questions. So audience, please send them in if you've got any. Otherwise, I've got a few of my own. So I guess to kick off with, I suppose, what was it like when you were a matron, and how has that influenced how you approached going about writing this handbook, which is obviously, incredibly useful?
Yeah, so when I was a matron, I was a matron in infection prevention and control, and I could really honestly say it was one of my proudest moments to have that title as matron. And so as you do, you progress onto a more senior role. But when I had a chance to... Can you hear me okay, Steve?
Yeah, absolutely fine. Yeah, great.
Okay, brilliant. Yeah, so when I had a chance to write the handbook at NHS Improvement, by then I had been gathering different information around the matron's role, around the ward manager's role, with the intention to work on a similar program. So I had also spoken to previous matrons about their job, how busy it was, and how they wanted some standardization. So it was a really good opportunity to go back live with some of those staff, having events with the NHSEI team, working together on that, and having various national events to get their feedback on the handbook.
Fantastic. And I say, you mentioned sort of looking back a little bit. Were there any particular matrons from earlier in your career that inspired you?
Yes, so when at my previous trust, for example, at the Nuffield Orthopedic Centre, where I started my specialist career, the matrons there, they held their job very proudly, and it's something that you aspire towards, having a similar type role, and to be able to have that authority and leadership in your job. So certainly that has inspired me, and I've liaised with other similar senior staff who were matrons in their more junior careers, such as Dr. April Brown, who did her research on the matron's role. She spoke proudly of when she was a matron. Also Liz Fenton, who helped you with the awards, she spoke proudly. So all of us seem to have so much pleasure in talking about our roles when we were matrons.
Oh, fantastic. So we've had a couple of questions in. I'll just pull those up. So we've got one from, you may not know the answer to this one, but I'll just find out anyway. So Paul Hardy, who asked in the previous session, he says, are there any similar handbooks for specialist nurses? And Rhoda Radalla, who was also involved in our judging from the awards yesterday, she asks, what are best practices in balancing the patient and family experience while ensuring adherence to infection prevention and control during the pandemic? So yeah, the first one's probably easier.
Yes. So in terms of the first one around the specialist nurse handbook, at the start of writing the handbook, we were determining whether we could have specialist sections, say for CNSs, or even could we had a separate section for community nurses or midwives or AHP. But as you could imagine, that would be a very big document, and we felt the way the handbook was set up, it was support all these different areas and speciality. However, as we speak now, there's lots of focused work and programs around IPC and support. So if anyone would like to contact me on the contact details available, I'm happy to help to guide them in that way around support for IPC nurses and specialists. In terms of the second question around balancing patient experience with IPC and quality of care. So what I always do as a senior staff that still work within the acute trust is try and visit the front line as well. Because you can see firsthand what's taking place and linking that with the patient need. Also speak to the patient as well, because often we do quite a lot of audits for compliance, which is very important, but speaking to the patient, they might observe something that's happening. They might also be very happy with the cleaning, for example, or other procedures, whilst we might be worried about it. So just really touching base with them. And when we undertake our surveys, make sure we include them in that.
Great, thank you very much. Sorry, yeah, I should have asked you if you wanted the questions one at a time. I gave them to you both at the same time, but you handled it perfectly. So brilliant.
Yeah. Yeah.
So another one from me. I mean, this again is a fairly obvious one, but I'm sure a lot of people listening will be very interested in adopting the handbook. How do they go about that? Is it basically all trusts being given it? Is it mandatory? Is it not mandatory? How do trusts and other employers, I suppose, get hold of it and get using it?
Yes, so thank you. So actually this event will help with the implementation, because we want to just get through to the end of the year and do lots of implementation events. So far in terms of implementation and adopting the handbook, we've had 2 live events in January and February, just before the pandemic hit. And since July, there's been a number of virtual events, including this Tuesday. We had one across the whole east of England, inviting national speakers and delegates. And also there are more events set up for next week that's run by NHSEI. And I've been visiting various trusts as well. So I've been to trusts having one-to-one sessions with them, having little webinars and master classes to develop it and help. So various trusts can share what they have been doing, and I've been helping to be the link between those organizations. So we have completed competencies, completed job description and based on the handbook, development programs and other things that staff can access to help with the implementation of the handbook in the trust.
Fantastic. Sounds great. So sort of final question from me then, just quite simply, what's your key bit of advice that you'd recommend to someone who was either about to become a matron or wanted to become a matron? Perhaps that's 2 questions there, I'm not sure.
Yeah. So actually we have a page in the handbook authored by Dr. April Brown around the advice. So we have said is be bold, go ahead and make those changes for improvement and patient care that you'd like to make. Also, the matron's role, there's lots of support out there for you. So if you see you'd like to take it up, don't be disheartened. Although it's a busy role, there's lots of support there. And also read the handbook and read the ward leader's handbook and the executive nurse handbook and how they interlink, because they all feed up into the director of nursing and the chief nurse's portfolio to help in preparing you for the role. And there's guidance and support around career pathways now, which often prior to recently that might not be readily available, and lots of links who you can speak to as well.
So it's kind of all about it's the fact that it's part of a sort of a chain, I suppose, that it all interlinks with the other roles and things like that. Would that be right?
Yes, that's it. Link straight up into executive nurse leadership and development and supporting the organization and healthcare. So
almost like a nice pathway. Yeah, Great.
Yes.
Okay. Well, thanks very much to Anisha. That was very, very interesting. Hopefully, you've inspired a few people to make the step to matron, sorry, and get involved with the handbook. So that would be really, really good. We've now got a 10-minute content break. So we'll see you again soon, and thank you again. Thanks very much.
Brilliant. Thank you.